The high-level section was convened by the National Tobacco Control Alliance, the Federal Ministry of Health, and other advocates for stakeholders to work for the implementation of earmarking in Nigeria. The meeting was attended by senior officials from the following ministries and organizations. We have the Federal Ministry of Finance, we have the Nigeria Customs Service, we have the Federal Ministry of Budget and National Planning, we have the Federal Ministry of Industry, Trades and Investments, we have the Budget Office of the Federation, we have the Federal Inland Revenue Service, and advocates including the Nigeria Tobacco Control Alliance, Environmental Rights Action, Civil Society Legislative Advocacy, CISLAC, UNIABUJA Tobacco Free Club, and Cedars Refuge Foundation, and also the Center for the Studies of Economies of Africa, CC. We have all the advocates present in the meeting, and the meeting was actually about conceptualizing and talking about tobacco tax earmarking, why tobacco tax earmarking, what should we do to get tobacco tax earmarking, and how should we approach the issue so that we can institutionalize and have a policy on tobacco tax earmarking. The meeting agreed on the following. One, that tobacco is a leading cause of death globally, and that the tobacco issue in Nigeria requires a urgent attention, especially with the various novel products and advertising methods that the tobacco industry are contriving in low and middle income countries, which Nigeria is one of. Two, that the burden of tobacco-induced diseases on public health of the country is high, and a concerted effort is needed to address the spate of tobacco-induced diseases in the country. And so we are also calling for political buy-in early in this administration, like Mr. Bode said earlier, that we are setting an agenda for the ministers that are just taking office. So we are also calling and making the public plea for political leaders buy-in early in this administration that tobacco tax earmarking should be one of the first set of things that will be done, most especially the Federal Ministry of Health. And so we are demanding, we are advocating, and we are asking for 5 to 10% of tobacco taxes to be, for a start, to be earmarked for public health and for tobacco control.
Or if they think that is the way to go, they create a separate tax line, for tobacco control. But the fundamental principle here is we want a percentage of what is being collected in tobacco, as tobacco taxes, to be used to fund tobacco control activities. Now, working the structure and the kind of how to operationalize it is the responsibility of the government. I've heard once that far back as the 80s that one tobacco company said that they pay 5 billion, one of them. So we know that it's actually way above 10.
Nigerian tobacco is one of the lowest.
So
that if you go to countries like Philippines and the rest of them, you find out that they collect taxes in billions of dollars.
Yeah.
And when you now talk about, if you convert this money into dollar terms, it is in fact, it is unforgivable to find out that Nigeria is collecting a petty sum of money of, in terms of collecting $10 billion over $10 billion in taxes on tobacco products, because this is actually one of the least countries that is collecting taxes on tobacco. I'll give you an instance. We made an increase of 20 naira per pack of cigarettes. If you go to a state in a state of New York alone, its tax on tobacco is over $2, and that means it is collecting over 700 naira, but we are collecting 20 naira. So when you make those kind of comparisons, you can now understand that the taxes we collect are way below what we should be collecting, so that we don't be carried away with one bill, because we've had $1 billion and we think that we are paying so much tax. So we need to put that in perspective.